There is a note of hope and optimism here in Oxfordshire in the UK, and a renaissance, if you like, around the whole notion of rehabilitation. And this will give people who are elderly and disabled hope for a brighter future. People in Oxfordshire who are experiencing long-term symptoms after getting COVID-19 are benefiting from an integrated service combining the expertise of Oxford's two NHS trusts, a spokesman from OUH has told me today. The long COVID service is run jointly by Oxford University Hospitals, OUH NHS Foundation Trust and Oxford Health NHS Foundation Trust. Specialists from the two trusts are able to triage each patient referred to them by a GP to the most appropriate service, whether that be in hospital or community-based support. Now, this whole notion of a multidisciplinary and cross-hospital collaboration comes with a huge level of expectation for us all here in Oxfordshire. One hopes that each trust will be able to access each other's notes more easily and be less in competition with each other. The clinic based at the Churchill Hospital began in January 2021, a spokesman from the trust has told me, with funding from the NHS England, although clinicians from both trusts have been working together and referring patients with long COVID symptoms for some months before that. So it does seem that it was an organic, natural process that has led to a more collaborative approach here. So the teams include doctors, nurses, psychologists, physiotherapists, occupational therapists from the two trusts, so offering physical and psychological assessments of patients who are triaged and referred to the right treatment and rehabilitation services. Let's hope that the whole notion of rehabilitation services grows and grows over the next few months. A recent survey by the Office for National Statistics, ONS, estimated that more than 1 million people in the UK had ongoing symptoms after contracting the disease. These longer-term symptoms can include anxiety and depression, breathlessness, fatigue, chest tightness, joint pain, problems with memory and concentration, insomnia, dizziness, headaches, and nausea. Now, anybody who is elderly or disabled will be able to relate to a lot of these symptoms on a day-to-day basis, whether they have a chronic illness or suffering with old age. So an opportunity to reinvigorate these services gives us all a note of hope. So one patient to benefit from the service is Dave Hockaday, a 48-year-old Oxfam team manager from Oxford who is still experiencing long COVID symptoms after contracting the virus last year. So Dave suffers from a tight chest, tinnitus, fatigue and a general malaise. He has also experienced digestive issues and bouts of insomnia which have left him drained. Now anybody who is maybe elderly or with a chronic illness will be able to relate to some of these symptoms. So let's hope that there is a renaissance of rehabilitation services to help people. He said, I have never in my life had sleep issues until recently. The insomnia was awful. First, it was hard to get to sleep, and that, coupled with the fact that I felt like someone was sitting on my chest and that I was suffocating, led to anxiety. Eventually, I would drop off, but then suddenly wake up with a jolt, struggling to breathe. So after inconclusive tests, Dave was referred to the Oxford Long COVID Clinic. He said the meeting with the team was huge as he felt like he'd run out of options. I'm sure many people who are elderly or with a chronic illness often feel this desperation that he felt. After so much illness and uncertainty, meeting Emma, who he refers to here, was completely different. Suddenly everything became human. Emma said my oxygen saturation readings were fine and I would benefit from some breathing techniques which involved breaking the urge to take deep breaths out of panic. And it started to give me a new outlook on recovery. So, respiratory consultant Emily Fraser, who heads up the long COVID service for OUH, is now involved with the trust, which is interesting because I myself have a illness called sleeping breathing pattern disorder, and there wasn't a respiratory physiotherapist available at the trust. So hopefully there will be a renaissance of this role and we will see other people who are respiratory consultants filtering through into our NHS system. Given the wide variety of symptoms that can be experienced by patients, she says it has been very effective having OUH and Oxford Health specialists working alongside each other in an integrated team so that we can make a quick and accurate assessment and refer patients to the most appropriate service. Yes, making quick, accurate assessments is something that the Trust often struggles with. I myself have had a problem which I reported to my GP in January. Eventually, I had various tests in May and waiting to hear the results now. So Oxford is very good at doing lots of assessments, but it can take some time, which obviously has all sorts of implications for the health, short term and long term, of the patient. So there seems to be an emphasis here on making a more rapid, accurate assessment. That could be a respiratory clinic at the OUH hospital, an Oxford Health community-based service, or both. So one of the rehabilitation coordinators from Oxford Health now, Emma Tucker, also called Emma, says we're really proud of the work that we've been able to do to help local people with long COVID to make progress on their long recovery journey. Our holistic approach, which pools the expertise of both trusts, means we can offer a tailored support that we will go a long way to tackling the problem. We recognise that rehabilitation is a primary aim for our patients and enabling them both to manage their symptoms and return to a previous level of activity. Amen to that sentiment, which I am sure comes as a wonderful note of hope to many disabled and elderly patients. I'll just read that again. We recognise that the rehabilitation is a primary aim for our patients and enabling them both to manage their symptoms and return to a previous level of activity. That's the dream. That's the bar that has now been set. So let's go for it. So a vast number of people referred to the services are in 20 to 50 age bracket, and so for many this includes supporting return to work. Another patient referred to the long COVID clinic is Leslie Channon, a housing campaign freelance consultant and writer from Burford. This single mother of two was admitted to hospital in April 2020, having got a secondary infection after contracting COVID the previous month. She said, 6 weeks post-COVID, I was barely able to walk to the end of my driveway. It was a slow, arduous journey to rebuild my lung function and physical capacity. Now, many people with mobility issues or elderly will be able to relate to this. So how have they helped her? So, Leslie's long COVID symptoms included shortness of breath, rashes, gastro issues, debilitating headaches, slow cognitive function, and extreme fatigue. So, what have they done to help her? Sometime in late October, my debilitating fatigue disappeared. It was as if a switch had been flipped overnight. I'm still not out of the long COVID woods yet, but it feels good to be finding my way back. So, there is a sense of hope, a sense of optimism, a sense of rehabilitation, and a sense that the trust is hearing that. Being listened to by my GP and by the COVID clinic was incredibly helpful, said Leslie, who was referred to a physiotherapist. I didn't realise that I was suffering from breathing pattern disorder, something that I have suffered with and not been able to get any help with from Trust as of yet. So I'm interested to see what help she got. So the tachycardia, high blood pressure, and other problems were all related to it. So I needed help to get my breathing back to normal, and that is where the clinic came in. I would like to say to anyone who thinks they may be suffering from long COVID, speak to your GP and ask for a referral. There may be times when you feel your symptoms will never go away, but there is hope and there is help out there for you. So, what a lovely note of optimism for all of us. I just read that again. There may be times when you feel your symptoms will never go away, but there is hope and help there for you. And that is exactly what people who are disabled or who are elderly want to hear from our NHS service. We don't want our expectations managed and given the worst case scenarios. We want to be enabled to live a full life as we have done previously. We want to be able to pick up our phone to our GP by being listened to by my GP, being able to pick up our phone to the GP, the receptionist picking it up within 3 rings. Wouldn't that be a wonderful thing? And your assigned GP to be able to phone you back and to not have such a massive caseload whereby they can give patients that support that they need. So it sounds like the whole notion of this COVID clinic is becoming a metaphor for the sort of rehabilitation service that the NHS Trust want to be able to offer everybody. So let's ride on the back of this enthusiasm and encourage this form of enablement.